There's a lot of reasons that can occur that cause pain in this area, but from a biomechanical point of view and what I would see on a day-by-day basis, again, I would relate it back to the nature versus civilization aspect. A lot of people walking on hard, flat ground may not cause pain in this area immediately, but the second you start to propel your body at an accelerated level, you can increase your force by up to 4 to 5 times your body weight. So what happens, again, if you sort of look at the foot and understand where the posterior crural muscles insert into your calcaneus, it's at the base and the back of the heel here. Now, we know that the posterior crural group are designed to assist you in the propulsive phase of gait. Now, the problem occurs when a person is running or a patient is running on hard, flat ground, the foot is pronating, and if you imagine an example of this being the heel, this the arch and the forefoot, if you hit the hard, flat ground, you start to pronate, it actually causes a deviation in the frontal plane of the calcaneus. At the same time, you've got a contraction of the gastrocnemius, the soleus, or the posterior crural group, in an upward direction. With this frontal plane motion, it causes a frictional force at the back of the Achilles tendon, which causes inflammation and then pain. Sure, people say you've got tight musculature in this area and stretching will help. But conversely, I say if you don't look at the biomechanics here and reduce the frontal plane motion, you're not treating the whole causation here, just partly symptoms, and not treating the patient in a holistic manner.
Okay, so it's really important to get that alignment in conjunction with the other therapies you're applying to treat.
Exactly. It can be a bit of a chicken and egg thing here. Some can say the pronation or excess pronation causes the increased strain on the musculature, therefore the tightness. Some people say the increased tightness can cause excess pronation. Either way, you've got to treat both factors. And again, the musculature plays a primary role, because if you do use an orthotic without advising stretching, you can shorten the tendo-Achilles area and actually aggravate the problem. So I do advise stretching in that respect as well.
Okay.
With people who suffer from pain at the back of the heel, which can commonly occur in this area called the tendo-Achilles or the Achilles tendon, we see the hard, flat ground creates an increased curvature here, and the foot starts to collapse out in the arch. If we bring the foot back where it should be, which is here, you'll notice that the pressure is on the outer side of the heel, but that's where your shoes normally wear out, and that's the proper way to walk. The arch comes up, but more importantly, the heel bone lines up with the curvature of the leg. If we let the foot relax, you see it rolls the other way, and this causes the inflammation, which we can see now, and the pain, which commonly is known with Achilles tendonitis.